Trump's healthcare plan. Promises and uncertainties. President Trump recently unveiled his Great Healthcare Plan in a video announcement, aiming to address affordability and transparency in the U.S. healthcare system. While the plan signals a potential shift in how Americans access care, significant details remain unclear, raising questions about its practical impact. The core idea involves direct financial support for consumers to purchase insurance and lower drug prices, but the devil is in the details. Who benefits and how much? The plan proposes sending federal funds directly to eligible Americans for insurance purchases. However, eligibility criteria and payment amounts are undefined. This vagueness makes it difficult to determine if the plan will genuinely improve access, especially for vulnerable groups. Even a substantial payment like $3,000 per person would fall short of covering average silver-level ACA premiums, which range from $5,400 to $7,200 annually before deductibles. Pre-existing conditions. A critical gap, a central concern, is the fate of protections for individuals with pre-existing conditions. The Affordable Care Act, ACA, guarantees coverage regardless of health status, a safeguard absent from Trump's proposal. Without explicit assurances, millions could face higher premiums or restricted care. Insurance companies previously denied or priced out those with pre-existing conditions, a practice this plan does not explicitly prevent. Drug pricing, incremental progress, unclear savings. The plan champions most favored nation drug pricing, tying U.S. costs to lower rates in other developed countries. Some pharmaceutical companies have already agreed to discounted prices for Medicaid patients, but the actual savings for these individuals remain unquantified. Trump Rx, a direct-to-consumer platform, will offer certain drugs at reduced prices, e.g., Wegovy at $150 $350/month. However, commercially insured patients may already pay significantly less, $25 a month in some cases, making the plan's impact incremental rather than transformative. Transparency challenges. The reality of healthcare costs. The plan advocates for transparent pricing from insurers and providers, a move widely supported by consumers. However, healthcare costs are inherently unpredictable. A simple emergency room visit can escalate rapidly, with final bills varying dramatically based on evolving patient needs. While transparency is desirable, accurately predicting costs up front remains a logistical hurdle. The Great Healthcare Plan resets the conversation around consumer choice and financial control. However, without concrete implementation details, many promises remain speculative. The plan's success hinges on clear execution, and the unanswered questions suggest a considerable gap between intention and reality. Whether it will genuinely improve affordability or simply shift financial burdens remains to be seen.